Advances in neonatology have increased survival rates for premature infants and newborns with serious disorders. We spoke with Dr. Istvan Seri of Children's Hospital Los Angeles to find out about the team of specialists who care for the littlest patients.
It's very important to understand that there's a continuum of patient care, especially nowadays, when we have a better understanding about the fetus. And we have come to the point where we look at the fetus also as a patient. So at that point, we start working together with the perinatologists. We have developed a perinatal neonatal institute. So we have a more complex team composition, but and we do it because the babies who are sent here are extremely complex. So many of our babies come actually in utero. When there is a diagnosis of a certain condition or an abnormality is seen on ultrasound prenatally, then the mom with the high-risk pregnancy is being referred to our institute. And then a team of several subspecialists will first investigate the problem. Then we all meet with mom once we identified what the diagnosis is. We also introduce her the NICU that she can see, and the family, where the baby is going to be treated after the baby is delivered. And we go through this process, which I believe is extremely important. The team composition is a maternal fetal medicine specialist, a perinatologist, a pediatric subspecialist according to the diagnosis. So if it's a surgical problem, let us say it's congenital diaphragmatic hernia, or a problem is lung development, then there will be a general pediatric surgeon who will do the prenatal evaluation with the perinatologist. These babies have to go through a detailed cardiac evaluation in utero. So a fetal echocardiographer and cardiologist will also be there and examine mom. Then there will be the neonatologist. And if there is a potential issue regarding inheritance, genetics, then there will be a geneticist involved. So just from the get-go, 4, 5, 6 subspecialists will sit down with the parents, and what we hope is we provide a fairly accurate assessment of what is going on and what we believe is going to happen. We always tell them, though, that intrauterine diagnosis is never complete until the baby is born and we confirm or throw out the findings. And there's one important issue that I really would like to make sure that people understand when they think about intensive care, neonatal intensive care especially, but probably medicine as a whole, is that what we try to do is we try to obtain evidence for what we are doing using methods that are non-biased and larger clinical studies that would give us hard evidence that what we are doing is really appropriate.